Hello, my friends. I'm Dr. William Harris, and today I want to talk to you about something that might seem small, almost too simple to matter, and yet it has the power to change the way you see your health, the way you live your life, and the way you take care of your heart. I'm talking about the way you measure your blood pressure. Now you might be thinking, really, doctor? That's it? But trust me, this tiny habit, how you measure your blood pressure, can make the difference between peace of mind and unnecessary fear, between confidence and confusion, and sometimes even between taking medication or not. I've seen it happen countless times. Have you ever sat at your kitchen table, wrapped that cuff around your arm, pressed the start button, and then felt your heart skip a beat when you saw the numbers flash on the screen? Maybe they looked higher than before. Maybe they scared you. Maybe for just a moment you thought, something must be wrong with me. You're not alone. Millions of people around the world have had that same moment of worry. They measure their blood pressure. They see a number they don't understand, and suddenly their day is filled with anxiety. They wonder if they're sick, if their heart is in danger, if their life is about to change. And sometimes that worry grows so strong that they end up taking medications they might not even need. But here's the truth, my friends. In so many of these cases, the problem isn't the person's heart. It's the way they're measuring. Studies show that up to 70% of people over 50 make at least one small mistake when checking their blood pressure. 70%. And these aren't big mistakes. They're tiny ones, the kind of everyday habits you don't even think about. A shirt sleeve left on, a cup of coffee too soon, a restless moment, or a conversation during the test. Little things that can throw off your reading by 20 or even 30 points. That's enough to turn a healthy heart into what looks like a dangerous condition. I've seen this happen again and again. People come into my office with stacks of home readings that look frightening. They're convinced their heart is in trouble. But when we take a closer look, we find the numbers don't tell the truth. They tell the story of incorrect technique. So today, I want to sit with you like an old friend across the table, with a cup of tea and an open heart, and walk you through the most common mistakes people make when measuring blood pressure, and how you can avoid them. Because when you measure the right way, you don't just get accurate numbers, you give yourself peace of mind, and you give your heart the respect it deserves. Let's start with one of the simplest mistakes, and yet one of the most common: measuring over clothing. I once had a patient, James, a retired engineer in his late 60s, who was absolutely convinced that he had dangerously high blood pressure. He showed me a carefully kept logbook, filled with readings that would make any doctor concerned. But something didn't feel right, so I asked him to show me exactly how he took his readings. He rolled up his sleeve, but not all the way, and placed the cuff over the remaining fabric. When I asked him to place the cuff directly on bare skin instead, his reading dropped by almost 20 points. Just like that, his hypertension disappeared. You see, even a thin layer of fabric can prevent the cuff from compressing your artery properly, and that makes your monitor work harder, giving you a falsely high number. Always measure on bare skin. The next mistake has to do with arm position. It might sound small, but it makes a huge difference. Your arm must be at the same level as your heart. Imagine stepping on a bathroom scale that's tilted to one side. You'd never trust that number. It's the same idea here. If your arm hangs down at your side, gravity increases the pressure and your reading goes up. If you lift your arm too high, the reading drops. Even a few inches can change your result by 10 points or more. So find a table or a surface where you can rest your arm comfortably, palm facing up, with the cuff snug around your upper arm, right at heart level. then just sit quietly and let the device do its job. And that brings me to another huge factor: timing and rest. I can't tell you how many people rush into the clinic or come home from a walk and immediately check their blood pressure while they're still catching their breath. I call this the white coat effect, or white coat hypertension. When you're stressed, nervous, or simply not at rest, your heart rate and blood pressure naturally rise. One of my patients, Maria, was nearly started on medication because her clinic readings were always high. But when she began measuring at home, after sitting quietly for 10 minutes with her feet flat on the floor and her mind calm, her numbers were perfectly normal. The body needs time to settle. Your heart deserves that patience. Always wait at least 5 to 10 minutes before testing. No rushing, no talking, no distractions. Just breathe. Speaking of talking, let me share another simple but surprising mistake: chatting during the test. You might not think it matters if you say a few words while the cuff inflates, but it does. Talking changes your breathing and your heart rhythm, which can cause your blood pressure to spike temporarily. I once watched a gentleman measure his pressure while talking to his grandson. The numbers shot up dramatically. When he stayed silent for the next reading, they fell right back to normal. Just a few words spoken at the wrong moment had added unnecessary fear. So remember, when you're taking a reading, treat that minute as sacred. Be still. Be quiet. Give your heart that moment of calm attention. Now, let's talk about something a lot of people overlook: caffeine. I know how many of us start the day with a comforting cup of coffee or tea, and I would never ask you to give that up. But caffeine temporarily raises your blood pressure, sometimes by 20 or even 30 points, for hours afterward. So if you measure right after drinking coffee, you'll get a false picture of your true baseline. That's why I always recommend waiting at least 2 to 3 hours after caffeine before testing. And for consistency, try to measure at the same time each day, ideally before meals and before your morning coffee. That way, you'll know you're seeing your true numbers, not a temporary spike. Posture is another important detail that's often ignored. I've seen people sitting on the edge of a chair, legs crossed, back curved, arm dangling, all while trying to get an accurate reading. But here's the thing: when you cross your legs, it restricts blood flow, and that can push your numbers up. Slouching or leaning forward can have the same effect. The right way is simple. Sit all the way back in your chair. Keep your back supported, your feet flat on the floor, your legs uncrossed, and your arm resting at heart level. Small adjustments, big difference. And perhaps the most important lesson of all: never trust just one reading. Blood pressure is like a story that changes throughout the day. It rises when you're active, falls when you're relaxed, shifts after a meal, and varies with your emotions. One reading is just one snapshot, a single frame of a long movie. Yet so many people, and even some busy doctors, make decisions based on that one number. I always tell my patients, take several readings at different times on different days. Watch for patterns, not single results. That's how you discover the truth. When I think back over the years, I'm struck by how often these small details have made a huge difference in people's lives. I'll never forget Thomas, a man in his 70s who spent months fearing for his life because of high home readings. He was so afraid he could barely sleep. But when we looked closely, we discovered that he was taking his measurements right after climbing stairs, with his arm hanging low and his legs crossed. When we corrected his position and waited a few minutes before retesting, his blood pressure dropped dramatically. He stared at the monitor in disbelief, then laughed, a deep, relieved laugh, and said, "All this time, I was afraid of nothing more than a misplaced cuff. That moment stays with me because it reminds me that sometimes the biggest relief comes from understanding the smallest details. So, my dear friends, here's what I want you to remember. Blood pressure is not your destiny. It's not a label or a verdict. It's a measurement, a whisper from your heart. But like any whisper, you have to listen carefully to hear the truth. Measure correctly. Be patient. Be calm. Give your body the respect it deserves. When you do, you'll not only get accurate numbers, but you'll also free yourself from unnecessary worry. You'll gain confidence in your own ability to understand and care for your heart. If today's message helped you, please do me a favor, hit that like button, subscribe to the channel, and click the notification bell so you don't miss what's coming next. Together, we're building a community of people over 50 who choose not just to survive, but to thrive, with strong, healthy hearts and peaceful minds. And now, I'd love to hear from you. Have you ever made one of these mistakes when checking your blood pressure? Did you ever discover that your numbers changed once you corrected it? Share your story in the comments below. I read every single one, and your experience might just help someone else in this community. I'm Dr. William Harris. Thank you for spending this time with me. Remember, every small, careful action you take today is a gift to your heart tomorrow. Stay well, stay strong, and I'll see you in the next video.